Okay, so in a gravity against gravity position, for this one I need to have my patient in prone. There are two different hand placement testing positions that they look at in Trombley. For the purposes of your practical, you're fine to do either one. Either one will be fine. It would be a clinical decision which one you would need to make, and one's looking at the middle track, one specifically looking at the rhomboids, but we're looking at the movement of retraction, scapular adduction. So my patient is going to start off in a prone position. My hand placement is going to, actually I'm going to have this, the shoulder is abducted and 90 degrees at the elbow and 90 degrees scapular abduction and 90 degrees at the elbow. This would be one that, this mat doesn't quite allow it, but if I had the hole here, if I had this taken out and I was able to have my patient supported, the arm supported on here, because I wouldn't want my patient right now just having to hold that isometric contraction. If we do it on this side, let me just show you what I'm talking about. See how right now she's having to hold that isometric contraction? So I would try to take this piece out of it and help stabilize that in some way if I was able to have an extra surface here of the mat. So maybe I have my patient slide over a little bit more so that that piece can be supported and we just get that adduction. Okay? All right, so I think this one is easier for you to see, right? So my moving arm for one of the testing positions, I'm going to look at that inferior angle, or not the inferior angle, I'm sorry, the medial border of the scapula. And as my patient comes up, I'm going to be giving that resistance into abduction. So I'm going to have you just, yeah, you can do that. Okay, so this one I can use the terminology, raise your elbow towards the ceiling, don't let me push you down, which I think is fairly, that makes sense, but again, I'd show my patient. So raise your elbow towards the ceiling. Okay, let me find that video. Okay. So here, I think because I'm on the other side. Sorry, guys. The main thing I'm going to be here, I can have my stabilizing hand against the trunk here and raise your arm against the ceiling, pushing down into scapular abduction. And I was a little off on her scapula. It's actually here, the medial border. Okay, do it again. There we go. All right, good. Stay in. Okay, yeah, that's okay. So the second testing position, if I'm going to be looking here, yep, no, you're right. They're in internal rotation, and I'm going to ask my patient to lift up and back. So lift your arm up to get that scapular adduction. So it's lift your arm up. My hand placement really doesn't change on that because I'm doing the same movement. So I can have a stabilizing arm against her trunk here. Along my hand that's applying the resistance is going to be along that medial border. And raise your hand up. Raise your hand up. Okay? All right. Go ahead and sit up. This will be the gravity eliminated plane if I have my patient in a sitting position. Now I've taken gravity out of the picture for scapular adduction and probably actually going to turn around. For this one, I'm going to help support the arm here. So I'll be supporting the extremity here to unweight it, and I ask my patient to pinch. Can you pinch here? Okay. All right, that's scapular adduction. Okay. Next, we'll look at scapular abduction.